foot and ankle surgeon, Dr. Benjamin Kamel. Welcome.
Welcome. Thank you for having me.
Of course, it's our pleasure. Before we get started, we always like to start with something interesting, either an interesting case. So if you could share a little bit about how the current pandemic has affected you in your field, and then maybe a interesting story in the podiatry field.
Yeah, sure. So in podiatry, we're very specific to the lower extremity, the foot and ankle, as you mentioned. So a lot of what we do, there are a good majority of what we see that are outpatient, sort of ambulatory, elective type cases, like bunion procedures, hammer toes, things like that. But then we also have things like ankle fractures or calcaneal fractures, things that are still happening. People are home, they're falling off ladders, they're falling downstairs, they're still breaking their bones. And these things still need to be addressed. And we're doing our best to keep these patients out of the hospital. So some of these patients we'll see in the ER, we'll reduce them, and we'll make sure that they're stable to get discharged and out of the hospital. We'll try to see them later on in the clinic, and when they're ready to have surgery, we'll schedule that, have their surgery, and make sure that they have the proper standard of care, while also trying to keep them safe from this COVID situation.
Absolutely.
Same thing applies with like infections and abscess and things like that.
Okay. Do you have an interesting story you want to share with our audience?
Yeah, sure. So I do have an interesting story. I thought this story always sticks with me. I had a patient who he's a young patient who was in a motorcycle, or he was doing like motocross, like for sport. And he said if he went off this big jump and he landed on his ankle, and for a few days he walked around on his like as normal. He said he had some swelling and whatnot, and he said that it started to become painful later, but he didn't notice it until a few days later, and he came in, and turns out he had an ankle fracture. How he was able to last a few days with an ankle fracture is beyond me. It was a pretty bad one too, but that was an interesting story to me. Maybe he was just really tough.
So a couple of months ago, I fractured my toe by just simply stubbing it on the furniture, dislocated and fractured it. But I didn't realize it. So I looked at it. I was like, okay, it's dislocated. So I reduced it, buddy taped it. And for 2 days, I was like, oh, I'm okay. And then finally I was like, you know what? This is really, really painful. I think it should have gotten better, but it hasn't. So finally I go and get an x-ray, and it's fractured in 3 different places. And I'm like, wow, I must be really tough or really weak. I don't know which one.
I think you're really tough.
But that's very interesting. So yeah, I guess your pain level can be different per person.
Yeah.
So can you give us a little bit of an introduction, about who you are, how many years of schooling it has taken you to become who you are today?
Yeah. So I'm a big sports guy. I love playing and watching sports. I was born and raised here in America, but my parents are both Egyptian. So I have the sort of foreign mentality when it comes to how I live my life. And a lot of what I do is based off of the morals that I was taught by my parents. Growing up in sports, and loving to play sports, I was always interested in orthopedics and just sports injuries in general. And what I found is that sports injuries, when you look at them as a whole, a majority of sports injuries are foot and ankle related, due to the fact that most sports are due to your foot, and your foot's always on the ground if it's a ground sport. So there's a lot of injuries that can occur in the foot and ankle. So I felt like I wanted to be the expert in the foot and ankle, and in orthopedics. And it's one of those things where when you get into podiatry school, you are a foot and ankle surgeon from the beginning. You know what you are, and when you graduate, you're a foot and ankle surgeon. Oftentimes people will go into traditional allopathic or osteopathic school, and they're there's many options of what you want to do, and sometimes you get into what you want to, and sometimes not. And I felt very strongly about going into something surgical and specifically orthopedic related, and this was a perfect fit for me. So it was 4 years of the traditional med school,
Mhm.
and it's 3 years of residency.
That's amazing. So you recently got married about a year ago. Tell
Yeah.
us a little bit of about how it's been balancing, your career while having a personal life, which I can attest to this, where I feel like my career has basically taken over my life. So there's not much of a personal life. So tell us about some of the things you do to balance that.
Yeah, it's really difficult. You have a lot of time that you're dedicating to your career, and you don't want to just go into your career and kind of, you know, do half. You want to give it your all and give everything that you have into it. So, by nature, you're putting a lot of time into this profession, but you can't forget about the people in your life and the people that you love, because they're the ones that support you. So, I'm pretty good at time management. I like to give myself a list of things to do every day,
Mhm.
objectives, whether it's exercising, which is very important to me. I need to exercise for my mental health and for just maintaining physical health. And um, I try to figure out what my schedule is for the day regarding my work. And then I always have to block out time for family and friends. If I don't block it out, it's going to get used by something else. So
Mhm.
that's essentially how I do it.
That's amazing. Sounds good. All right. So, can you tell us a little bit about the challenges of going into podiatry? Like you mentioned, you're a foot and ankle surgeon. You could have gone the allopathic, osteopathic route, or versus the podiatry route. So, what were certain factors that came into play? Whether it's tuition, whether it's the amount of time you spend, or the specificness of that specialty or field. Can you tell us a little bit about that?
Yeah, sure. Like I was saying, I think a lot of it had to do more with the speciality itself. Um, as specific of a field as podiatry is, it's actually very involved in the fact that you deal with diabetic patients, you're dealing with people with vascular disease, neuropathy, and things that affect the foot and ankle, which are whole body type diseases.
Mhm.
And you're also dealing with the orthopedic aspect, which is mostly where my passion lies. But the field itself was why I specifically chose it. Tuition is definitely less than the traditional allopathic or osteopathic routes, which is a huge plus.
Mhm.
I've learned that the more these student loans build up, the more stressed you get about paying them back. So the less you have, the faster you can pay it off, and the best, you're in a better financial situation in the future. And you know, income for a podiatrist, it varies. It depends on what you do. You could be in a hospital, be a hospital-based podiatrist. You can do private practice, work in a big group, but the salaries are comparable to any of the other specialties in medicine. So,
Very good. Have you decided whether you're going to do mostly inpatient, outpatient?
well, I think I'm gonna mostly do outpatient. Um, I would like to take trauma call, so whatever patients come in the ER with any sort of trauma, I'd like to be a part of any of those services. So I'll try to pick up on any of those at the local hospitals.
Sounds good. So, what are some things in medicine that either you want to change or want to see change in your lifetime? I mean, certain things in medicine that, frustrate us. What are some things that you've noticed, especially in the podiatry field, that, you'd like to see changed?
Yeah, so I mean, access to care is a huge thing. I feel like um, people who need care sometimes don't have the ability to get it, whereas the people who can have care don't need it as much. That's an issue that I know is echoed through, has echoed throughout time, and I'm sure there are many different ways to go about it, but it's one of the biggest things that frustrates me is giving people care who need it and but can't either afford it or don't have access to it. Um, so I try to um, see like the benefit, and there's there's this bad side to it, but the benefit is that we can offer care to those people. I'm a believer in helping people in need whenever they can. I don't think I need to charge everyone for everything that we do, but yeah.
Absolutely. All right. So, what are some things that you would offer as advice to students that want to go into podiatry? Looking back, I mean, are there certain things that you regret doing, or are there things that you're like, you know what, if I had to do this all over again, I'll do exactly the same thing?
If I would do this all over again, I would do it exactly the same. I think that what's important is kind of finding out truly what it is that you want. So a lot of times you'll see, um, this isn't always true, but you'll see osteopathic students who went into osteopathy because they couldn't or didn't do allopathic school. And you see the same thing in podiatry. You'll see some students who come into podiatry because they couldn't or didn't do, allopathic or osteopathic. And it's almost like they fell into it, rather it's something that they wanted.
Mm.
And just like with anything in life, if you don't have a passion for it, if you don't like it very much, then you're not going to enjoy it.
Mhm.
So I would urge those that are interested to really research the field, shadow, really like make sure that this is what you want to do, because there's a lot to it. And if you're not interested, you're going to not be happy. And it's important to be happy in what you do, right?
Absolutely. Absolutely.
Yeah.
So, how competitive is podiatry school compared to, going to an MD or DO school? And when you were applying, how many programs did you apply, and what would you recommend somebody going into the field? How many schools should they be applying to, and what was your experience like?
Sure. So to answer the first question, regarding competitiveness. So just like with allopathic or osteopathic school, same prerequisites apply. You need to take an MCAT. The average scores tend to not be as high as those of allopathic or osteopathic schools, but it's not as easy as just doing the prerequisites and taking the MCAT. You have to score well to be considered, or to be able to get into the schools. As far as actually applying to the schools, I at the time I used to think like, cast your net wide, and that's what I did. I applied to all the schools, but I was accepted to I interviewed and was accepted to Western University before I had a chance to interview at any of the other schools.
Mhm.
And given that it's local to my home and it was a school that I really liked, I didn't even go to the other interviews. And I went to Western University.
You're lucky, because I've heard that Western is one of the most competitive schools to get into. So
It is, yeah. I was lucky. I was definitely lucky.
that's amazing. Well, Dr. Kamel, thank you so much for taking time out of your busy schedule to talk to us, to talk to our audience about podiatry and what makes it an amazing field. Are there any thoughts or anything else you want to share before we wrap up?
No, I think that's it. Thank you for having me. I appreciate it.